So it is the end of the year and it's exams and the practice are busy. So many people present with, I think I have ADHD, or doctor, please, my child needs something to pass this exam. What can I give him to concentrate? Now there's so many myths surrounding ADHD, the diagnosis, the treatments, etc. I want to just touch on 3 today. The very first thing is, how do we diagnose ADHD? ADHD is not something that we can diagnose with a checklist over the internet and you merely tick, check, and yes, I have the criteria. When we diagnose ADHD, it requires a full clinical comprehensive assessment, which requires time. And we talk to the patient and the parents and we get collateral information and we base the history together. And only when you have a certain number of symptoms fulfilling the criteria for ADHD, the core triad of inattentiveness, hyperactivity and impulsivity, and it causes you functional impairment in various domains of your life, consistently so, across work, across school, across family life, then we would consider a diagnosis of ADHD. Bearing in mind there's many other conditions that can mimic ADHD and also lifestyle issues like a lack of sleep and also excessive screen time. So we really need to tease out carefully. The second thing is this whole script that we have that ADHD is being overdiagnosed. Now, to a certain extent it is true, but I would like to specify it's rather the overtreatment or overprescription of medication than an overdiagnosis of ADHD. Especially in more privileged areas, people have access to psychiatrists or general practitioners that's very quick sometimes to prescribe the treatment without establishing the diagnosis. But in the vast majority of the population, people do not have access to treatment, and people also aren't aware necessarily of the symptoms of ADHD. So overall, ADHD is definitely not overdiagnosed. The third thing maybe to address is whether it is bad parents. And we have confirmed with research over and over again that parenting is not the cause for ADHD. So have empathy with the mum and the father that you sometimes see with a child that's maybe very, very hyperactive, but saying that not all children with hyperactivity has ADHD either. ADHD is genetic, so in 80% of people we will find that there's a family history of ADHD. And if you have ADHD as a parent, maybe parenting a child is more challenging, but it's definitely not a parent's fault that a child have ADHD. And lastly, maybe let's talk quickly about medication. ADHD medication is extremely effective and safe for patients with ADHD. However, the medication can be abused by people without ADHD, such as those with substance use disorders, or even people using it for so-called cognitive enhancement. But research has shown that it's not nearly as effective for people without ADHD that's using it, and it can merely make a 2% difference maybe in performance. If you take it, you may be more alert, more awake, and put in a bigger effort. So is it worthwhile using ADHD medication when you do not have ADHD? My view is a definitely no. Good routine, good habits, exercise, enough sleep, limiting your screen time, and really putting in the effort, that is what will make you successful if you do not have ADHD. But medication can be absolutely life-challenging for an individual with ADHD.